As of this time, there has still been no confirmed cases of COVID-19 in Grand Forks County. It's evident the virus is spreading all across North Dakota, and as the state's third largest city, it's imperative we continue to be vigilant and cautious, stay the course with physical distancing. The health of our citizens is the number one priority. We'll be talking today about a longer-term economic and social sustainability plan that's important as we look at the overall well-being of the economy throughout and after this COVID pandemic. But I have to stress that priority remains community health and flattening the curve. The stronger we come out of the crisis from a health perspective, the better off we will be during the economic recovery. The economy will come back, our people won't. While staying at home, it's important to take care of our mental and physical health. I encourage everyone to get outside and go for a walk or run, exercise at home if possible. Read a book, play games, reach out to friends and family members by giving them a call or writing a letter. We're in this together, even if we are social distancing in our homes. While we have some free time on our hands, this is a good time to respond to the census. It should only take 5 minutes to complete. You should have received it in the mail, or you can fill it out at 2020census.gov. Governor Burgum has stressed an all of government, all of community approach, and that's no different in Grand Forks. Remember to support local. I've made a few executive orders this past week, and I appreciate the community continue to support local businesses. This week, community and business leaders held listening sessions for businesses in the effort to hear their specific concerns and issues and facilitate that information to our state and federal partners. They've been insightful and valuable feedback has been heard, and we look forward to hearing from the nonprofit sector this afternoon. I want to thank Council Member and Jobs Development Authority President Brett Weber for his engagement with our business community and leading these important discussions. We'll check with Dr. Weber today for an update on those listening sessions and how we're moving forward with economic and social sustainability planning. EDC President Keith Lund and Chamber President Barry Wilford are available today as well for any questions. First, we'll check in with Dr. Deere from Altru and Dr. Brenner from the school district. We are in good hands, but we need to do your job as to keep our community healthy. Complete your census, be cautious, be vigilant, and be North Dakota smart. Stay home and save lives. It's that simple. Thank you.
Thank you, Mayor Brown. We will go over now to Dr. Deere. Go ahead, Doc.
All right. Thanks again for the opportunity for the updates from Altru. We continue to adjust our operations on a daily basis. It's really been outstanding what we've been able to do as a health system and operationalizing a lot of changes over the last week to 2 weeks that are very patient-centered. We're focusing on video visits as a way to allow access for patients to continue to see us. We've discussed cares for the most vulnerable, and we'll be going to nursing homes, assisted living centers, and other places throughout the community to offer care there and limit people in and out in those facilities. We also continue to transition into a sick clinic, and more information on that can be found on our website, altru.org/coronavirus. Our testing continues to be quite brisk, and that our COVID hotline and our testing continues to be ongoing, and that's a 24/7 operation. We, like most other health systems across the country, are preparing to experience some financial challenges related to coronavirus. Our focus and decisions continue to be patient-centered. Every decision we're making isn't about finances. It's about what's best for our community and our patients. I just want to reassure everyone here that we're a community-based health system, and that's our focus. To date, Altru's completed 552 tests across our region. I know we like numbers. There's still no cases in Grand Forks, as Dr. Brown said. We do have cases all around us. There are 4 cases in our area, 3 in Ramsey County, 1 in Walsh. Another thing that's in the national news is the discussion on supplies. And we're managing this topic and supplies on a daily basis. We feel that we're managing appropriately and our staff are safe at this time. N95s, surgical masks, and testing swabs are those that are the most needed. We continue to work with the state and our suppliers on this, and we feel like we're in a good spot locally. Well, we want to thank our community for the outpouring of offerings to do and make masks. At this time, we cannot accept those. That's not to say that in the future we may not be on this type of forum asking that changes. As with everything of coronavirus, our stats and numbers that we give today, as well as some of the outlines from the North Dakota Department of Health, may change tomorrow. We just want to keep the community updated and informed at all times. And I thank the city for the opportunity to continue to speak on Altru's behalf.
Thank you, Dr. Deere. We will now go over to Dr. Terry Brenner from the Grand Forks School District. Dr. Brenner, please go ahead.
Thanks very much, John. I appreciate being here today and having a little bit of a platform to share what's been happening in our school district with the entire community. This week has been an incredible week because we have incredible educators across our 19 campuses. We put together a deployment plan to get student materials, student devices, student band and orchestra equipment, everything that had been left behind in schools. We put together a comprehensive plan specific to each building level to get those materials back into students' hands and back into homes by doing a curbside pickup. And so on Wednesday, we were able to accomplish that task with all of our elementary and middle schools. And on Thursday, yesterday, we completed that task at both of our high schools. And not only was it just a major feat to pull off, but some of our teachers and support staff are having a little bit of fun doing it as well. You probably see some videos going viral sometime either today or this weekend. So the important piece is we are ready to go with online learning on Wednesday, April 1st. The good news is many teachers have already started reaching out to their classes. They've built classroom lists. They have created classrooms through our Seesaw platform at the elementary level and through Google at the secondary level. And just back to the deployment of materials, our original plan was to get technology devices into the hands of all 3rd through 12th graders. And within 24 hours, we were able to turn that around based on the survey that we did with parents, assessing what their needs were at home. We were going to create a phase 2 to get technology devices into second graders' hands in week 2 of this process. When all was said and done, every kindergarten through 12th grade student has access to a device. And for those people who don't have internet capabilities at home, we have purchased cell phones that have hotspots, because just ordering a hotspot individually in and of itself, they're on back order by 3 or 4 weeks. So we're able to get the hotspots through phones, get those deployed to families. And by all accounts, some of the feedback that I've received, unsolicited feedback from parents who have sent me emails, everybody is pretty pleased with how the process is rolled. So that's probably the big news. The second part of the big news is Emily Carl, our Director of Child Nutrition, has been averaging 1,500 lunches, 1,500 breakfasts each day as parents have been swinging by to pick up food. So we're anticipating that number will grow as long as we're out of session. But we are pleased to provide that service as well. And there have been a number of other community agencies who have stepped up to partner with us in meal deployment. So with that, I'm sure Joe Bowen is going to have some questions toward the end. So I will yield my time, the rest of my time, to those others who are on this call as well.